What's good, dudes and dudettes? Welcome to Just a Dude Podcast, the spot where we keep it real, dig into life's wild stuff, and maybe crack a few coffees or any other drink that you like. No judgment here. I'm your host, Nathan, just a dude trying to figure it all out, and today we're going big. We've got a guest who's basically a healthcare Sherlock Holmes, Greg Vigdor. This dude wrote a book series that's part mystery, part what's wrong with our health system, and it's going to blow your mind. Stick around. Healthcare's never been this fun. All right, everyone, let me roll out the red carpet for Greg Vigdor. This guy's the brain behind the Irv Tinsley Health Policy Detective Series, a series that's like CSI meets your doctor's office. He's got a master's in health administration, a law degree, and he's been knee-deep in fixing healthcare for decades. Now he's the volunteer prez of the Washington Health Foundation. Greg, welcome to the show, dude. How's it feel to be the health policy detective king?
Well, the kingdom's a little shaky lately, so I'm not sure.
It is, that's for sure. Can you tell us a little bit about your journey, as far as healthcare leadership, your work with the Washington Health Foundation, basically your origin stories like you were a superhero?
Yeah, from a superhero perspective, I'd probably say it's something like an introvert goes wild and does some good stuff. And
I love that.
The long version of it is I grew up around healthcare. My dad was a dietitian at the local hospital in Hartford, Connecticut. So I started volunteering when I was about 2 feet tall in the cafeteria. Ended up getting a job in the hospital storeroom. Became the storeroom supervisor when I graduated from college. Had no idea what I wanted to do with my life, but I did start to figure out that I wanted to have some greater purpose to it. It's actually pretty important in my books because the theory of Irv, that's actually what the theory of Irv is. That instead of sort of being self-indulgent, try to do something for the betterment of others. But meanwhile, I kept falling into these things in healthcare, these great jobs. I became an assistant nursing administrator at the tender age of 24 in an inner city hospital that was pretty big. It was like, how did that ever happen? Then I decided, at a whim, I'd apply to one law school just to go because it was in D.C. where it seemed like health policy was coming from. Not in Hartford, Connecticut, Washington, D.C. Well, I got in. And the next thing I know, somebody found me and recruited me for a job with a law firm right around the corner where I worked full time while I was going to law school. And I was basically, my job was to follow health legislation and regulation throughout the federal government. Like a kid in a candy store. Instead, I keep getting these crazy opportunities and several more. And so the short version of this is I'm going like, wow, these are incredible opportunities, and I'm really learning a lot. I'm getting pretty good at the stuff that people are asking me to do. But there's only so much I can do because I knew I was pretty shy, very introverted, had my own very laid back style, which even some of the people I lobbied in DC told me about. And one guy told me I should move to Seattle after I graduated where they're more laid back because my style just didn't fit, which I did, oddly enough. But meanwhile, I was meeting all these people, leaders in healthcare and government. And I started scratching my head and going like, there's a healthy chunk of them that are introverted like me. In fact, they're more introverted than me. And the ones that I respect the most actually seem to be the ones that are introverted. So I just started saying, well, wait a second. I've been sort of setting my sights too low. I thought I'd have to find some staff position. There's only so much I could ever do because you have to be loud and boisterous to really try to do something big. And so I said, what the heck? I'm just going to try to do stuff that's big. So instead of just following into just good jobs, I started finding jobs where I could actually lead healthcare. And I could do some things that were in my head about trying to make the system better. And I also got fortunate. Time after time, I found another great job where I could try to do that. Started up the Washington Health Foundation from pretty much nothing. Became the head of the Arizona Hospital Association. Again, job after job where I had this chance to engage and do big things to change healthcare for the better. And did some good along the way. And not enough good because when I sort of stopped working full time in 2019, I realized healthcare was still a mess. Proud of a lot of the work I did. Well, what can I do next? And that's what turned the chapter in a literal way to my writing, where I became an author and said, well, maybe I can start writing books and educate people about why it is the way it is and how we might fix it for the better. So that's kind of my origin story in the short version of kind of how I got here today, writing strange books about odd characters trying to do good things in healthcare.
Yeah, but that's an amazing story, Greg, because you use those opportunities to not only advance yourself, and get into these good roles where you could actually make a difference, but then you utilize those as well to help influence policy and to help, try to fix healthcare. And as we spoke before, when we first started off, I work in healthcare too on the revenue cycle side. And trust me, we could spend weeks and weeks talking about how we could fix the system and only put a dent into it.
Yes,
So but I
absolutely.
appreciate, definitely coming from my background, I appreciate where you're coming from, especially when you go into our book series. And your book series it's the Irv Tinsley series. It's a detective adventure, right?
Yes.
But it's also really about America's healthcare mess. And so can you walk us through this? Like, what's Irv chasing and why is it hit so close to home for us regular folks?
Yeah, so there's two dimensions to my books. One is that they're fictional medical detective stories, crazy, fast-paced, page-turning thrillers about things gone horribly wrong in healthcare settings and things around them. But meanwhile, it's also this thread of real American health policy, written, I believe, fairly simply about helping people understand why it is so screwed up and really trying to relate to people's experience and trying to use it. So that's the big framework. But in terms of the story itself in Irv, and especially the first book and sort of his story, there's really three different elements to it. One is the fictional detective story, which is there's something gone wrong. And in this case, Irv Tinsley is a public health investigator who's on call one night in Seattle, Washington, and he gets a call out to a cabin in the woods in the Pacific Northwest, and he finds a dead body with all these nasty things all over the body. And he immediately goes to, and I actually wrote this part back in like 2010, goes to, it's a pandemic. I'm going to have to do something about this. So he starts to engage as a good public health officer would do. And he immediately starts going, there's something fishy about everything that's going on here. And he starts to realize, one, that it's actually not a pandemic, and two, that everybody, including his boss, are telling him to back off and stand down. And Irv, being the conscientious, purposeful guy he wants to be, says, well, what the hell? I've stood up before to my bosses. I'm going to keep digging. And he finds something actually even worse than a pandemic. And what it
Wow.
is sort of even relevant today. It's actually the administration, this part was written back in 2020, using the healthcare system to try to deport illegal immigrants in a very underhanded and devious way.
Yeah.
And so he stumbles upon this pretty significant plot going on and decides to engage and try to solve it. But meanwhile, there's other things going on. The second level of challenges that are really related to everybody, just about everybody at some point in their lives faces healthcare challenges. And what I try to do throughout is have many little stories about the characters and what they're going through that reveal some of the weak points that many people encounter. Irv himself, his mother dies of breast cancer when he's a little kid. His wife gets breast cancer. He's semi-functional for quite a period of time in his life because he's so afraid about what might happen next. A key character in my book is a woman who goes to a hospital emergency room, and she's told she has to leave, even though she's terribly sick, and drive to a hospital about an hour away. She loses consciousness, crashes, and dies, and it becomes one of the key moments in the book. But this stuff happens.
It does. Yeah, absolutely.
Irv's best friend, his wife, dies of an opioid overdose. Just as many people, she needed it because she had a skiing accident. Next thing he knows, she's addicted and dies of an overdose. Again, these healthcare encounters that people have, and trying to sort of have Irv live through those challenges as well. The third part of it is just Irv himself. And what I learned is I didn't really know anything about writing novels, but I picked up some books. I realized you have to develop characters. So Irv and all the characters, I really try to have that lead a lot of the story. And so Irv is a flawed guy who has his ups and downs. And when he starts this book, he's in a real down cycle. I mean, things are really bad in his life and they're only getting worse. And so I really try to bring out that part of Irv as he tries to deal with this huge problem that he's confronted that has impact on all sorts of other people. But meanwhile, his life is a mess and it's not getting any better. That's kind of the book.
Yeah, and you know what? It's something that we can all relate to because we all have our ups and downs. We all have different things, and I love the fact that you're bringing stories in about the healthcare institution as a whole to show that, it also shows the reader that, hey, you're not alone in these things. These do happen to
Exactly.
other people, and we're trying to fix it. But with your book, how did you sneak all this policy stuff into it without it feeling like homework? What was the trick to that?
So the starting point to this was 2019 when I stepped down from my last big job, really big job. And then there was a pandemic, so I had a lot of time on my hands. I wasn't really intending to retire. So I always wanted to write a novel when I was a little kid. I said, well, it's my bucket list. I might as well write a novel. I've got a lot of time on my hands. So I started to do that. But I realized I wanted to write two things. One would be this medical detective story, the fictional piece. Then the other thing was there's this 40 years of experience and knowledge I have about health policy. And it's pretty deep and pretty different health policy perspective that I have. And I said, I really feel like I should write that down somewhere before I'm off this earth. And I
Right.
started to do that, and I started writing it. And I realized I'm bored writing it. And I'm going like, there's got to be a better way. And that's when I had the idea. And I never really expected to publish my books and have them sell thousands of copies. But I said, I'm going to try to fold the health policy into the novel and sort of communicate the policy pieces. And I'm going to try to make it interesting. And so what I decided to do, I really played around this for a while. I finally said, there's historical fiction. So I took the concept of historical fiction and created
Yeah.
some other fictional characters who have a relationship to the contemporary characters. So like one of the Irv's best friends is helping him solve this case. Well, her great-great-grandfather was in on the origins of American health policy, as was her father. And so I tell their stories. And again, I hope in a very entertaining way that will make it not the usual dry policy read, but
Right.
something that sort of comes to life through characters and stories and the way tales have always worked in, mankind's history.
Yeah, and I love that because you're bringing it to a level to where normal everyday folks can understand the challenges that we face in the healthcare, marketplaces and just the healthcare system overall, but also allowing them to have some types of fantasy in there, so to speak, or fiction, like you said, to bring it all together so it's not like reading just a big policy book with 1,300 pages worth of policy that's going to put you to sleep in about page two.
Like, and this first book, it is pretty long, but it does move along very quickly. People always tell me that. But I've written two more books so far, and I'm working on my fourth. Both the second and third are substantially shorter, and there's more medical detective story and less health policy for those who want more of a different formula, a little bit less truth and more fiction.
Yeah, exactly. But that's nice because you give a nice overall arc to it to where people can really learn and get involved with the characters and really feel a part of it. And that's what I loved. And that's why I wanted to bring you on because, being in healthcare, when you hear about healthcare stuff, it's always straight and to the point, right? It's always, there's never fiction really involved with it. So that's
Right.
what really sparked my interest to have you on the show. But, one of the things that I kind of got from this was, we're basically saying healthcare is a crime scene, you know? And
Yes.
but from your perspective, because you've been doing this since the 90s, what's the biggest whoops that you've ever seen in the system? And, does Irv crack the case on fixing it?
He starts to. There's a lot of work to be done. But just about everybody has some experience with healthcare, and it's usually around the core problems that usually are on the newspaper, that it's expensive. I mean, horrifically expensive, that things go wrong, sometimes because it's an act of God, and sometimes because people or organizations screw up. Too many people know that sometimes when you need it, you can't get it. Lack of insurance, people being thrown out of emergency rooms. Sort of, it's out there and could save your life. It's the miracles of modern medicine, but you can't get it. And then so many of us, now that I'm semi-retired and using healthcare more, experience this myself, that it's such a consumer unfriendly system. I
Oh,
mean,
so
the
much.
experience of trying to go into any healthcare setting and get a straight answer is like beyond prayer. So I try to talk about these things, but for me, when you get to kind of the core policy defects, it's really that it's not a system. It's just a bunch of fragmented pieces that develop that way for reasons over time. That's the historical tale I tell, how it was really organized around diseases and specialties and physicians who specialized in a care of this part of the body and that part. And then the money part started to come in, and we started to organize it around the money. And then we organized it around the providers. And then we organized it around insurance companies.
Mm-hmm.
Now we organized it partly around the government. We have never really organized it around patients or people.
Yeah,
And
you're
so that's
absolutely
the
right.
fundamental problem.
Yeah,
That's a
and I
lot
think
of what we do.
And I think a lot of times too, we see some providers trying to, fit a square peg in a round hole sometimes, like a one size fits all, treatment plan, when in reality, we are all different individuals, and what works for one person may not work for the other. And, I wanted to add on to your part, Greg, there too, is that the money part is such a hard part, and that's essentially what I work in. And the
Right.
fact of the matter that we see, providers all the time submit a claim to an insurance company without the proper documentation. That's what my company tries to do, is to prevent that from happening in the first place, because at the end of the day, we want to try to reduce or eliminate denials, because that affects our patients. And, because if you're a patient and you just had a surgery and you get a $50,000 bill because your claim's been denied, that's one thing we want to not happen, and to start reaching these things so we can make more consistency with payments, which in turn will allow doctors to do their jobs and give better care to the people. But yeah, it's definitely a broken system for sure.
Exactly. And there's so many pieces of it. And these are the ones that millions of people experience. It's sort of like work that you do. With
Yeah.
Washington Health Foundation, one of the things we did, we had all sorts of programs and grant things. But one of the core ones was we ran a phone service where people would call us up if they couldn't figure out how to get health care. And we would sort of backfill and sort of arrange appointments with providers who would take them, make sure they had bus fare to get there, work through the systems with the government to make sure it was okay that they do it. And without that, the system doesn't work. And it just shows it's a patchwork system. It's not a true system. And you got to figure out a way to make that stuff happen normally as it should in better systems, way better systems in healthcare.
Yeah. And Greg, one of the things that I was thinking about as you were talking about, your time in DC was, do you think from your perspective and in your experience, is there too much regulation in healthcare or not enough?
Well, the honest answer is both. Some of the wrong things are regulated and some of the things that should be really aren't.
Yeah, exactly.
One of the big changes, again, my origin story way back when I started doing my thing in DC up on Capitol Hill, there were like a handful of healthcare lobbyists and organizations that were in the rooms trying to do deals that sort of spoke to how a 25-year-old kid like me could get in a room and somehow be trying to close deals. But now if you did it, just like everybody has their own lobbyists. There's like probably 10,000 lobbyists running around doing it. And the system is so imbued with the money part of it and people trying to preserve their pots and their power and their control. So it's again, sort of just an extension of a lot of the other things we see that's gone wrong with our government. It's all around a system that doesn't work in the first place. It just sort of exponentially makes everything worse.
Yeah. And so for most of us, in your mind, Greg, are we screwed or is there hope for this system yet?
Well, one of the core values of the Washington Health Foundation in my career is optimism and hope. And there's been times when it's hard to find it. And I'm sort of going through one of those stretches right now. All the books that I've written are just filled with hope. The good guys win in my books. They have to, or I couldn't write them. And I believe they will. And I try to talk about solutions and practical solutions. And there are things we can do. And you can see that they're possible to even get passed into law and do something with them. So there is that thread, and I'm still there.
Yeah.
Recently, though, with a lot of it probably won't be out there till August, but as we're talking in April, there's a lot of changes now going on around healthcare in Washington, D.C. And I'm kind of shocked that the things that are being talked about getting changed are actually some of the few things that are working, not the things that are broken. And so I'm kind of at a low point trying to figure out, well, what do I do? How do I incorporate this in my books? What do I say? Am I still a leader in healthcare? And should I speak up, or is that the wrong thing to do? Should I let this play out? But some of the things that are going are really deeply troubling around sort of the attack on prevention, medical research, which the essence of American medical care has been incredible discoveries that have changed lives for the better over 100 years. And ways that people never imagined. These are the things that are getting attacked without really a clear reason why.
Yeah.
So that I'm a little skeptical right now.
Yeah, I think to go on to that too, I think that's part of the whole thing where, a lot of folks in our country right now are looking for the reduction of size of government, the reduction of spending. And I think a lot of people want most of these things to go private, because let's face it, private companies generally do a better job at fixing things than the government does, But I think that's one of the reasons why that's going in there. But you're absolutely right that we need to keep a close eye on it, because if the government shuts down some of our funding to help do research and to help, fix all these other problems, then we still have to ensure that on the private side they pick it up. And, so that's going to be a very hard balancing act if we do get rid of some of that, public funding money that the government gives. So, yeah, I agree with you 100% on that.
Yeah, and I'll agree right back with you, because I think that's exactly right. And that's kind of my frame. It's much more of a private entrepreneurial view than adopting, single government payment system. That's not where my head's ever been at on these systems and solutions. But these are things that we know the private sector won't do. I could give you stories in my career where I've sat across the aisle from CEOs who have told me that if you took some of these ideas and you'd sort of doubled what they might get to try to do something about these things, they said, we still wouldn't do it.
Yeah.
Because it's
because at the end, in the end of the day, right, they're trying to make money. Even our nonprofits, right. I hate to say it, but our not-for-profits, right, they still make profit every year.
Big profit.
And people don't realize that, but it's, their intention is not to make profit, but if they do, it's okay. So a lot of people are saying, hey, how can, you get CEOs and stuff of health systems that say, hey, how can I make more money off of this? How can I increase my revenue, as far as what I can take in? And, that's one of the bad parts about going private as well. So it's really a double-edged sword, Greg, because you can say if the government does it, well, it might be swayed by politics. Yeah. But on the other hand, if you say, let's let the private industries do it, they're going to be swayed by money for sure.
Yeah.
So
my mentor had a great story he told me once about all of this and sort of the not-for-profit hospitals and the good works they do, which was typically called community benefits.
Mm-hmm.
And so somebody asked him once in a public setting about what's the definition of a community benefit. He goes, oh, that's the stuff that if you're doing it, you don't tell the hospital CEO or you won't be doing it anymore.
Exactly. No, and it is so funny because I used to work for one of the a large healthcare organization in Ohio here. I'll just leave that to you. You probably know which one it is, but they're number one in heart. But even though they're a not-for-profit organization, they made millions of dollars of profit every single year. And, but I do have to give them credit because they did do a lot in community programs. Yes. So, they were at least doing that. But, a lot of people think when you hear not-for-profit that they don't make any profit, but they definitely do.
Yes.
Yeah. But is there something, Greg, in your mind, is there something that, a regular dude like myself or, any of our listeners really could do about this, to help become part of the solution as opposed to part of the problem?
Yeah. So right now, the noise to signal ratio is so high, it's hard. I can't figure out what I should be doing. That's what I'm struggling with because I'm not sure I could get through it, given it's just the conversation is sort of at an insane and intense level. It makes no sense. But I think all we can do is try to engage and try to let the people who are in power and people we vote for, at least let them know how important healthcare and health is to you, even if you're not sure what the solution should be, and then try to find things that appeal to you. Again, I try to find solutions in all my books that people might look at and go like, well, that makes some sense. Maybe we can do something like that. Some of my ideas, I look at them and go, there's probably no way I can imagine how that politically will happen. But the idea is to try to find these ideas and start working, especially on things that we can agree on, not all these things that divide us. My view for 40 years of this has been intentionally so by both political parties to pull us apart on healthcare issues because it's so actionable in terms of politics and money. Where meanwhile, this is a lot of the work of the Washington Health Foundation, we found a huge consensus of people in the middle who thought healthcare was a huge problem, it needed fixes, these were available, and they'd like to agree on things with their neighbors, not fight over them. And why can't we do those things? And let's start finding those things.
Yeah, and Greg, that's a common message on my podcast here is I like to tell people that, with the divisiveness that we have in this country right now, We need to stop saying it's either my way or the highway and start going back to saying, you know what, we've got so much more stuff in common than we do that's not in common. Let's focus on those things for a while. Let's just be human beings and we'll try to work together on things that we can agree on and finally get some movement in our government and in our country, really.
Yes. Yes. And there's a
Yeah.
huge swath of people who believe that. I would dare say a majority, if not a super majority.
I think so. I think the people that make the most noise, have the biggest platforms, but I think that they don't really, they don't really represent the majority of us normal everyday people,
Yes.
But,
Yes.
Those people with the biggest platforms make the most noise. And so that's what we hear all the time, but that might not necessarily be the same. But no, I think that's a great advice, though, Greg, about getting involved. If you're involved in healthcare or want your congressperson, senator, whoever it may be, state, local, it doesn't matter. Write a letter, send an email. If you're passionate about it, we can all work together to try to get some positive change in our healthcare system, which, let's be frank about it, it's needed. It's definitely overdue.
Exactly. Engage in podcasts like this. A lot
Yeah.
of the vitriol is coming from the social media world, and the parts that we see really has kind of gone really crazy.
It's
What you're
totally
doing
different.
is another piece to trying to give some balance to that world that is just so hyperbolic and conflicted.
Exactly. Yeah, we need to quit being so one-sided and find that common ground and just get back to the middle where we can actually get things done.
Talk
Yeah.
things through.
Exactly. And so your first book, The Theory of Irv, is a beast with over 700 pages. Now, I don't want to throw any of our listeners off, but what possessed you to write a healthcare epic, and how'd you keep it from being a snooze fest? I know we kind of talked about this a little bit, but I just want to dive home on this because I think it's amazing that you were able to put this policy in there and not make readers fall asleep.
Yeah. So it was a bucket list thing. And when I first did it, I thought I'd get 2 copies printed and I'd put it on my shelf and that would be the end of it.
Right.
And I sent it out to some friends who said, this is really good. You have to do something more with this. And so that's when I sat down and I started going, whoa, maybe I should really try to make this a real novel. And I went back. And so the real test was myself. Said, I just read it from many times, cover to cover, and said, if I get bored, it's time to revise that chapter. And so one of my core design principles in the book to keep it moving was very short chapters. So there's always something going, and it starts with something and it ends with some question mark or some drama. And so again, it is a long book, but just about everybody that has read it and has gone through it has said, no, it really keeps moving. It is, you got to like reading to enjoy the book for sure, but it does move. It moves really fast. And my subsequent books move even faster.
Yeah, and that's nice because when you make the chapters nice and short, it gives people a nice little break point to where, they're not trying to stay in it for hours and hours to get through a chapter or two. And, I find for myself, Greg, that, breaking things up into smaller chunks like that, it helps me keep focused on the book and I actually complete them then,
Right, exactly.
So, but yeah, and so obviously you had that process going on where you would read and reread and you would say, oh crap, this is too real or too techie or too, policy white. And then, so you would balance it out by, yeah, exactly. And you'd say, you know what, if this is making me bored, it's definitely going to bore someone else. So that's how you kept up with it, right? Exactly. And that's awesome because, to take something that can be as boring as healthcare policy and put it into, a crime adventure is fascinating to me just because, I'm a healthcare nerd anyway, but, I love that. Yeah. Greg, I want to pick up the pace just a little bit. I have some rapid fire dude questions, as I call them. This is a new segment, but just some really easy questions. First thing that comes to your mind, no overthinking. We'll hit through these. So, and this is based off of, what you're doing, but what is your favorite detective ever, real or fictional?
Well, you got to go with Sherlock Holmes, but a close second worth noting is Jim Rockford, the Rockford Files.
Oh, yeah. That's a good one. I like that. Weirdest healthcare fact that you've ever learned?
Well, it's really that it's not about people. It was when I was a nursing administrator at the hospital at 24. And since my job was nurses, a lot of it was about staffing and getting the staffing set up for our volume based on whether the hospital was full or half empty or what. And the craziest thing for me from the start was when I'd be sitting in these meetings with the administrator and others in influence in the hospital, and they'd all be bummed out when it was empty and really happy when everybody was sick. And I was the one that said, why are we so happy when everybody in the community is sick?
I know, exactly.
And they looked at me like I was a nut. And that's when I realized, oh, wow, I've got some thinking to do about what I'm doing.
Exactly. I like that. All right. If Irv had a theme song, what would it be?
Right now, it would be Things Have Changed by Bob Dylan.
I like that.
Partly
Yeah.
just because it's sort of things are out of whack and times are
And it,
crazy. People
and
have
it's like
changed.
change. Exactly. It seems like nowadays too, it just seems to be changing every couple of days too, especially with healthcare.
That's
But
right.
yeah,
Locked up tight, I'm out of range. I used to care, but things have changed.
exactly. All right. So when you're writing, what's the best snack for a late night writing session or just any writing session, really? What's your go-to?
Usually dark chocolate. You get a good buzz, but not too big a buzz.
Yep. That nice, just a little bit of bitterness in that chocolate to get you going. I love it.
Yeah, and a little reward. You half of it.
Exactly.
And if I finish the chapter, I can have the other half.
I like that. You're kind of rewarding yourself to keep going, right?
Kind of like a chipmunk.
I like that. All right, last one. One word to sum up America's healthcare system today.
Perplexing.
Oh my gosh, that's so true, because it is perplexing. Because when you think you fix one thing, it seems like six others pop up, doesn't it?
Bloop. Yep, absolutely.
That is crazy. So, Greg, in your book series, how many books do you have altogether? Is it 3?
Right now, I have 3 books, and I'm working on the 4th.
Oh, nice. And what are the names of the 3 books for our audience?
So the first book is The Theory of Irv, really the origin story. The second book is The COVID Murders, which is set around in the Nashville area and a death in a hospital there and some crazy things. It's not really about COVID, but it's about the time that we can at least agree was called COVID.
Yes.
And the most recent one that I just published this past January is called Death Panels. And there we're exploring the questions about life and death, who gets what in terms of medical technology that can save people's lives and who doesn't. And I try to present some interesting ways of thinking about that social problem.
Awesome. And you said you're working on another one right now?
Yes, the next one is called Frontier Health. That's the operative title. And I want to explore rural health because that was one of my specialties in my career. And it's another one where I'm watching what's going on. And I know so much about what needs to happen to preserve rural healthcare in these towns all across America. And I'm watching the opposite being done. And I'm kind of just scratching my head again, going, well, what do I do? I mean, this is not going to be helpful.
Yeah, and you know what? It's great that you're tackling that, because I think a lot of us that live closer, close-ish to a bigger city, we know where our health systems are and where we can go for care. But when you get out in the country, in the rural areas, and especially like with the Amish, I know one of the hospitals I worked with, we had a lot of Amish population that would come in. But I mean, they're talking 2-3 hour drive to get there.
Right.
And it's like, so you don't realize that there's really no emergency care out in the rural areas. And so what are we going to do to kind of fix this and gain access to these folks?
Right.
So I'm glad you're tackling that.
Right.
I love that.
Yeah. And it's worth mentioning, in so many of those communities, the local industry is actually the hospital.
Yeah, no, you're right. Because
if the hospital goes, the rest of it is probably tumbleweeds in a couple of years later.
You're absolutely right, because I've seen that with communities here in Ohio where they've had a big healthcare system, and maybe somebody bought them up and then they decided to close it. And it's like, you don't realize what that does to the economy in that area when they lose that many jobs at once. And not only the economy, but the health of those folks too, because now they got to find new providers. They got to go to new places, drive, further. And so access to care then becomes more of a pain. And so some people may not seek it,
Right. Which then gets to all sorts of other questions, like the future of agriculture in America, which is already going through. Everything just starts to unravel, which is kind of like tearing my hair out recently.
Yeah. And so, Greg, with your books, where's the best place for our listeners to go to grab those?
So the best place to check them out is I have an author website at gregvigdor.com. And so you can get to buy the books through that really easily. But I also have a free mini book on there that you get just by signing up and giving me your email address. And you can sort of check it out. I wrote a little short story-ish called Election Diagnosis. And it's about a guy who's wanting to work on the future of healthcare reform and trying to figure out who's going to win the election this fall. And the same day that he gets the answer to that, he gets a terminal healthcare diagnosis.
Oh, goodness.
And so he's got to work his way through all of this. And that's kind of the story. It's just a sort of a little mini piece of the entire series. But people get a sense for what I write about and how I write and if they like it or not.
Yeah, no, that's amazing. And that's gregvigdor.com. Greg, we covered your books. I love the healthcare aspect. Like I said, we could probably talk for days and days and days about how we could fix the healthcare, what's wrong with it. But I did want to add, is there anything else that you want the audience to know about your books, about you, anything really at all?
No, just to take care of themselves. And, the thing about the healthcare system is, on the one hand, there's all these problems that I write about, but the other side of it are these miracles that happen every day. And these caring people in these hospitals who, by and large, I'd say like 98% of the people that I've worked with in my long career were just wonderful, talented, smart, committed people that ended up maybe doing the wrong thing because the way the system worked, not the way they were. And so it's sort of find the good in the system, even while we're trying to deal with the consequences of the bad.
Yeah, and I want to echo off of that too, Greg, that a lot of people I have worked with in healthcare, and I've worked with people from all over organizations, whether it be the, security officer working at the front door, the nurse that's helping you on the unit or in the ER room, to the doctors and I've just had the opportunity to work with everybody kind of like you, except for not in policy. And you're right. Like 98% of the people are there for the right reasons because they want to help people. They want to give you the care that you deserve. But sometimes we do get lost in the system, which is unfortunate. And hopefully with your books coming out and with people hearing this podcast, we could start writing our elected officials and telling them, that we want to fix this problem and hopefully be a voice for everyone.
That'd be great. Thanks for what you're doing.
Definitely would be. No, thank you, Greg. I love the books. I love the ideas. Obviously, I didn't have time to read the books before we had this podcast, but I guarantee you I'm going to buy them and purchase them because this is something that I've been looking forward to for since we signed up for this. So, Greg, thank you so much for being on the show. I really want to encourage the listeners to go out and check out Greg's books and gregvigdor.com at his website and get that free book just to see if you're going to like it. I mean, all it costs is your email. So get out there and do it. Well, that's a wrap, dudes. Greg Vigdor, you're a total rock star. Thanks for breaking down healthcare at Irv's Wild Ride. Our audience can buy your books at gregvigdor.com or wherever books are sold, and Greg will have a guest page on justadudepodcast.com. So make sure you go out there and check out Greg's series. Links are in the show notes as well. If this hits you in the feels, let's smash that subscribe button if you wouldn't mind. Drop us a review and tell your buddies about Just a Dude Podcast. Got your own healthcare horror story? Hit us up in the comments or shoot us an email. Until next time, I'm Nathan with Just a Dude Podcast. Keep it real, keep it chill, and we'll catch you on the flip side.